Malnutrition occurs generally when an individual's diet does not provide enough or the right balance of nutrients for optimal health. It's not necessarily related to the overall weight of an individual, so they don't necessarily need to be extremely underweight. It can affect people who are within smaller bodies, who are underweight, but also people who are within larger bodies as well.
So, what kinds of conditions and what people are you finding are susceptible to malnutrition?
The people who are most susceptible to malnutrition are generally people who are experiencing another type of condition as well, such as having cancer. They may have chewing or swallowing difficulties, which can come about through complications from conditions such as having a stroke or Parkinson's disease. They may have dementia or depression. They may be admitted into hospital with or without surgery, or they may be experiencing social isolation. Often people have an inability to cook or shop and feed themselves, and this can certainly be a risk factor for malnutrition as well.
Do you find it also is a higher risk the older you get?
So it can be a risk factor becoming older, but we also know that it can affect anyone within the community. We need to really be keeping an eye out for the signs of malnutrition, and these can be things such as unplanned weight loss, experiencing a loss of appetite, or lack of interest in food that lasts more than a couple of days. Really feeling tired all the time, having muscle weakness, getting sick often, and taking longer to recover is a really important sign as well. And it's important that if you notice any of these things happening in yourself or in a loved one, that you speak with a GP or with an accredited practicing dietitian.
So, April, I understand that you have had first-hand experience of this with your beautiful grandfather, Alf.
Yes, so over the last 12 months, my grandfather Alf has been receiving extensive radiation treatment to skin cancers on the side of his face and neck. He experienced many of the negative side effects from these types of treatment, which included things such as mouth ulcers, a lack of saliva production, which can impact on your ability to swallow. He really just lost interest and lack of motivation to consume food, even though my nan Val was doing the best that she could to prepare all of his favourite meals.
So, what were the signs that indicated to you that he may be experiencing malnutrition?
He lost 10 kilos over the course of 6 months. And when someone loses that amount of weight, as I'm sure you're aware, the notches on the belt need to be moved in, your rings don't fit anymore, and clothes become a lot looser as well. So he had all of the telltale signs there.
Well, Alf was fortunate that he has a beautiful granddaughter who is a nutritionist. So, what were you able to do to help him?
So with Alf, we commenced him quite early on an oral nutritional supplement, and he was having 2 of these a day. He would have those around what meals he could consume, but the benefit of having an oral nutritional supplement in his case was that it really alleviated some of the stresses and the pressures of mealtimes.
Yeah, because I imagine the more you are experiencing malnutrition, the harder it is to kickstart the momentum to actually eat food.
Yes, that's certainly what happens. People will become less interested in eating, which then affects their appetite as well. And it's really a nasty cycle.
How quickly did Elf start to feel better?
He's maintained his weight now, which is also really positive. He's not losing any further weight and has managed to put a couple of kilos back on too, which is definitely what we were aiming for.